Okay, welcome everyone. My name is Anjum Sultana, and I am the National Director of Public Policy and Strategic Communications at YWCA Canada, the nation's largest and oldest gender equity organization. Today, we'll be talking about a national action plan on gender-based violence. This conversation will be talking about very traumatic and difficult situations, so we did want to provide a content warning. Please take the time you need to feel safe and secure as we have this conversation, because we know that this can be challenging. And we will be talking about two different surveys related to gender-based violence today during the conversation. So what I'd like to do is formally welcome you. And we have this event in the context of the 16 Days of Activism against gender-based violence. So yesterday marked the International Day for the Elimination of Violence Against Women. And during this time of pandemic, this time period where we talk about gender-based violence in our work holds even more weight. The reflection and the action we need to take is even more salient, given the devastating impact of the shadow pandemic of gender-based violence in the wake of COVID-19. With this in mind, today we will be talking about how we can leverage this moment to push forward a national action plan on gender-based violence. We thank you for joining us today. Before continuing, we want to do a land acknowledgement to honor the First People. We're acknowledging the enduring presence of Indigenous peoples in this area for time immemorial. In doing so, we must also recognize the harm that settler colonialism has perpetrated and continues to perpetrate on First Nations, Inuit, and Métis people. I also, during land acknowledgements, like to talk about my own lived experience and positionality. I'm someone who was born in India, grew up partially in Saudi Arabia, and then immigrated to Canada. And so I think about what role I play as someone who also must respect and acknowledge treaty rights. And so with that, I also want to make note that we are connecting virtually. And as more of us spend time online, it becomes clear that these spaces can be made unsafe, especially towards Black and Indigenous communities, racialized communities, gender and sexual minorities, people with disabilities, newcomers, immigrants, refugees, and migrants, as well as other communities who experience intersecting forms of marginalization. Let's do our best to create a space where we can all safely engage. Today, I will be going through what we will be covering. So I just wrapped up some of the opening remarks. Towards this presentation, we'll be talking about what exactly is the National Action Plan on Gender-Based Violence. We'll do two presentations, one by Lieran Docherty of Women Abuse Council of Toronto, and another by Erin Whitmore of Ending Violence Association of Canada. We'll have some time for a bit of discussion and Q&A. I do want to note, if you would like to ask a question, please do use the Q&A function on the Zoom. You'll have the opportunity to ask questions. And while we may not be able to get to all of them, we'll do our best to track them and see if there's opportunities to continue to engage afterwards. One thing to also note, if you would like to talk about this webinar and tweet about it, you're welcome to do so. You can use the hashtag #PastDue and also tag us on Twitter at YWCA_Canada. And then we'll wrap up with some closing remarks. So the topic of this conversation today is the National Action Plan on Gender-Based Violence. And that has become even more important during this time of COVID-19 because we've seen the rise of domestic violence. In the work that we do across the country, from coast to coast to coast, we've seen gender-based violence increase. So in Canada, we've seen rates increase as high as 20 to 30%. In some of our shelters across the country, we've seen that number triple or double. We've seen that not only has the severity and the magnitude of gender-based violence increased during this time, it has also transformed. We've seen the rise in cyber violence, and we've seen racial profiling. We've seen abusers, threaten to evict women and children and gender diverse people, sometimes threaten and sometimes follow through with that. We've seen unreported elder abuse, and we've also seen threats of deportation by employers, by sponsors. This is just the beginning of what we've started to see, but it's quite clear that in times of pandemic, the need for a national action plan is even more dire. So what exactly is the National Action Plan on Gender-Based Violence? So to answer that question, we want to go a bit into the historical context. So for many, many decades, we've seen United Nations set a goal for countries to establish a national action plan. This has come up in documents as early as the 1970s, the 1990s, 2002. But in 2010, we really see this come to a head. And the goal was that each nation would establish a national action plan by 2015. In Canada, that did not get realized. And so feminist groups from across the country set in motion, and they decided that they would develop a blueprint to develop a roadmap for how we can get there. So this was established in February 2015, and I would like to talk about the incredible leadership of organizers and organizations like Women's Shelters Canada, Lise Martin, Amanda Dale, and many, many others who made this work possible. In 2017, we saw that advocacy push the dial. We saw a national strategy to address and prevent gender-based violence. And while good, a strategy is not a plan. Fast forward a couple years later, 2019, we saw mentions of a national action plan in several parties' election platforms. And when the Liberals received a minority parliament, we also saw that again in their mandate letters. We saw again in the throne speech in 2020, so it feels so long ago, earlier this year. And we're expecting to see more reference to this in the federal fiscal update that has not happened yet, but is tabled to be happening on Monday. So if you're following this work, Monday is going to be a very important date to see if we're going to see more information come out on the need for a national action plan. So what is it that civil society has put forward? So in 2015, there was a blueprint that was issued, and later on, we'll put it in the chat so people can read. Earlier this year, in the summer of 2020, there was a reissued call for a national action plan, and it built on what was already passed and pushed forward in 2015, but it went farther. It really talked about the importance of having an intersectional national action plan, recognizing a one-size-fits-all approach is insufficient and ineffective. So really recognizing the ways in which intersecting forms of marginalization create more vulnerability and more harm for certain communities, and having tailored and targeted approaches. It's not enough to be tinkering around the edges. We need a bold and ambitious plan. And so the 4 pillars of the National Action Plan is prevention measures, service measures, legal and justice responses, and a social policy response. And if folks would like to talk about this more, really welcome you in the Q&A to ask questions about this. The other critical part of the National Action Plan is a need for all of government approach. It's not sufficient for just the federal government to take a leadership role. We need to see the provinces and the territories at the table as well. So we see universal standards, we see universal implementation. And finally, the last point we'll mention in brief is the need to have this harmonized with the National Action Plan to stop violence against Indigenous women, girls, and Two-Spirit peoples. And so with that, I want to invite you, as we put the link in the chat, if you're interested in endorsing this plan, please do. These are some of the organizations that took a leadership role in the 2020 reissued call, and we would welcome the opportunity to invite more people to participate in this critical advocacy. So without further ado, I'll pass it over to our presenters. So first, I'd like to introduce Lieran Docherty. She is the Manager of Programs at Women Abuse Council of Toronto. Over at Women Abuse Council of Toronto, she oversees the organization's research and policy work. Her primary area of focus is on the intersections between violence against women and economic security. I came to know Lieran through our work together at the Maitri Policy School, and I found her to be an incredible wealth of wisdom and a kind-hearted and generous person. And I'm so excited to have her here to present her work at Women Abuse Council of Toronto. So without further ado, I'll pass it over to Lieran, but I encourage you to please follow Lieran on Twitter and tweet today. So her Twitter handle is right below. And without further ado, I'll pass it over to Lieran. So I'll just stop my share, and Lieran, it's over to you.
Wonderful. Thank you, Anjum. I trust that my screen is being shared.
Yes, absolutely.
Wonderful. Sure. Well, thank you so much, Anjum. I really do appreciate the invitation to share today, and I appreciate the time that people have taken out of their day to join today. I know this is a busy week out of this very busy year for people working in the sector, so I really do appreciate it. So I'm going to briefly share some information and data that Women Act has been gathering on the impacts of the COVID-19 pandemic. I was telling Anjum, I'm going to share a bit of recent and new data that we have related to the use of technology by survivors. So it's part of ongoing research project that Women Act is undertaking, but I pulled out some kind of early data from this because I think it's going to be really important, not just for the conversation today, but going forward when we're looking at a national action plan during pandemic time. What does it mean for technology and technology for women? So very early on, we heard from sector partners about the need for very swift and coordinated information gathering and documentation. So we started gathering data in the first week of April, initially through surveys with executive directors, managers, frontline staff across Toronto. And while the approach over time has become a little systematic, mainly because we recognize people's time in completing surveys. So we're trying to now gather data more in a little less disruptive ways. So through meetings and committees and when people come together. So I recognize that during this pandemic, things change quickly, despite some days and weeks feeling very long, I recognize. But what I'm sharing to you today is really some common themes we've heard. So let's get right to it. So early on, we heard obviously from survey respondents and from survivors about the challenges that survivors are experiencing. 60% of respondents spoke to the increasing risks that survivors are facing as a result of being socially isolated with abusive partners. So most respondents shared, what we know, right? These risks have been increased, these known risk factors, and that's isolation and financial stress, unemployment, and substance misuse. In some recent interviews we've undertaken with survivors, we've also heard the fear of the upcoming holidays, right? A time of year when we see a seasonal rise in incidents as well. We hear a lot about the difficulties faced by survivors in accessing support, mainly due to a lack of privacy in the home, not being able to physically access services, places that they would, under normal circumstances, maybe be able to make a safe phone call or see a worker face-to-face. And of course, we hear a lot about the rising tension and stress in the home, right? A common theme is a financial pressure that women are experiencing because of a lost wage and the difficulty in paying rent and bills. This is often compounded with financial abuse. We know women are losing jobs and they're leaving work at a higher rate than men, especially those in precarious work. And we still hear, and we heard even when the province has suspended eviction notices, that women are receiving eviction notices. And I'm sure some of you have seen some research that's come out in the past couple of weeks to show that the highest eviction rates, at least in the city of Toronto, are in the same areas in which COVID-19 has hit the hardest. So I really think there's some work to be done across these intersections between that loss of work, the housing, the violence, and looking at that from an intersectional lens to understanding the impact of that on different populations of women. And of course, another common theme I think is really important that we heard is that, women and survivors, they are in limbo. They're feeling in limbo. Things have paused, including their own goals and their own plans. So we asked organizations also about their greatest challenges. You know, what's keeping them up at night? And this is kind of what things look like in early days. We haven't actually seen a massive change. So the majority spoke to staffing, the lack of PPE, funding, that client access to basic needs and services, and that inability to practice social distancing in shelters and services, and a bit of a lack of communication between governments, organizations, and sectors. And of course, no surprise probably for this audience here today, more than half of respondents early on shared about their worries about potential cuts to funding. You know, funding events have been canceled or postponed. Foundations, sponsors have changed their programs. They pulled out partnerships. So while there has been some emergency fund come down, of course, many violence against women sector agencies anticipate that, you know, fundraising efforts will be negatively impacted for several years. So we asked organizations what they need, and we continue to. We hear a lot of different things. Just a couple things out of this list I'm going to touch on, because I think it's very relevant for our conversation today. We hear a lot about the need for that increased coordination and cooperation between governments, and not just between governments, but between governments and violence against women agencies. So that coordination and cooperation between governments and women's and feminist organizations. And of course, we hear a lot about the need more than ever to be open and communicating with each other and working closely to share information, share resources. We do hear that there are some, you know, concerns of the increasing pressures and limited fundings, and a lot of organizations and sectors are fearing that with austerity measures may lead to increased competition among the sector. So I think that's something we have to be mindful of as we have these conversations about a national strategy action plan as well. And lastly, while we ask organizations about their challenges, we also ask and hear a lot about how individuals in the sector are doing. So many spoke early on, and they continue to speak about the importance of the support they're receiving from their colleagues, how much they miss that camaraderie of working in person with their colleagues, you know, that opportunity to discuss challenging cases, that opportunity to check in with each other, or have that kind of social time, buffer time between work and home that many people don't have these days. We hear obviously a lot about the complex and challenging ways in which their work has changed. So some spoke about their reliance on creativity, you know, their advocacy skills to navigate new processes. And, you know, this is something we continue to be in such admiration of, that changing to facilitating group programs online, to offering counseling by phone, to developing new relationships with clients through virtual means. And even just the challenges in kind of completing housing applications without in-person meetings, without easier access to documents. And lastly, the thing we hear most about is housing. You know, we were in a housing crisis before, we are still in one now. We hear time and time again that housing is a key barrier for women fleeing violence. Shelters are working at capacity, and even before the pandemic, they were working at capacity, and at least in the province of Ontario, you know, on average, 200 women were turned away from shelters every day because of a lack of space. That was pre-COVID. So affordable rental housing is limited. You know, we know most women leaving an abusive relationship are in financial hardships, but also shelters aren't the only answer. Women right now want housing options. We're in a pandemic. They want and they need long-term housing options, as well as that option to remain in their own home with the abuser removed. So really what we're hearing from the sector is we're working within a system, a housing system that is overwhelmed. It's still overwhelmed. Housing agencies and organizations are trying to be responsive, trying to build their capacity during this time. And then of course, the workforce and survivors are then navigating this overwhelmed system and in crisis, navigating and in crisis. So that's a little bit of what we've heard. As I mentioned, this is a bit of an outlier, but I stuck it in because I think there's some recent data that we've been pulling in one of our projects I thought might be relevant. So WomenAct is conducting research right now into the relationship between survivors, technology, and looking for help and support. So this project is particularly looking at legal information and support, but we're asking a lot of questions around women's experiences with technology. So I'll preface this by saying that the data here is based on about 55 surveys we've received to date from survivors who have experienced intimate partner violence in the last 5 years. Some is current, some is historical abuse within the last 5 years. As I said, this research is ongoing, so what I've presented today has not necessarily been overanalyzed. It is not intersectional what I'm showing today. That work will become. But just a couple things I thought were interesting. So we asked about technology, and what we heard is 87% of the women survivors we heard from have a cell phone, 70% report that they have internet at home, 61 report that they have a personal computer or tablet. So it gives you a bit of sense of access, and actually these numbers are lower than what statistically we often see amongst this population. We also asked about the rate of their confidence in using technology during the abusive relationship. And 20 said they were extremely confident. More so, 43% reported somewhat confident. But interestingly enough, we also asked, how do they rate the confidence of their partner or ex-partner in using technology during the abusive relationship? So that's on the right-hand side, you'll see there, and 35% said their partner or ex-partner was extremely confident in technology. Just a few other things I think are important to notice. So over 70% of survivors that we've spoke to or have conducted our survey reported that their partner monitors or monitored their phone, text messages, email, internet browsing, right? So this is definitely a concern about survivors feeling unsafe, uncertain about their privacy and security online, especially when accessing services, right? 60% reported that they've never accessed a computer at a library or at a friend's home or in another safe space. So I think this is critical because anecdotally, we often hear a lot from policymakers, from community agencies. I've said it before, right? And it is important, that public important of access. City of Toronto is now launching some programs around public Wi-Fi access. But very important here to note that 60% of women we spoke to are not currently using that or haven't used it when they've needed to access a safe space. And then also 70% reported that a barrier to accessing legal information online is the repercussions, the potential repercussions from an abuser, a partner, ex-partner. So while I appreciate that this is about legal information, I think we can make a pretty safe assumption that this might apply to survivors who are looking up other information or services online related to the abuse that they're experiencing. So just a little snapshot, the research is ongoing. We're still conducting the surveys and interviews. So please do get in touch if either you're interested in participating or partnering on this work. But I do think we need to be continuing to discuss the role of technology and gender-based violence and help-seeking behaviors when we're speaking about a national action plan. And last couple thoughts from me, I'll end where we're feeling hopeful, where we can look forward. We are trying to ask the sector, what's working well. Let's document our learning, and most importantly, let's demonstrate the value of this sector. And it's really important that we're documenting what is working well so we can help inform a national action plan. Two things I would like to mention, because I think they're relevant to this conversation, is we are seeing an increased coordination between some levels of government. So the example here is the City of Toronto and violence against women sector, particularly on some housing policies and programs. So we've seen some work happen behind the scenes where the sector and the city are working together on applications processes, interactions with survivors, improving a trauma-informed approach during this time, and all with the intention of improving access to housing programs and making the processes more efficient and effective. So very positive stuff. We've also seen in some cases where organizations are really working to reduce barriers to services and programs. And something we've always advocated for as a sector, right? That we often hear from survivors that they're faced with more restrictions, they're faced with more eligibility requirements than they are entitlements or supports, especially when it comes to social housing, social assistance, legal aid. So in some cases, we've seen the system let up a bit, right? We've seen organizations move housing applications online or remove the level of documentation required. Into Ontario previously, most of you will know, in order to be eligible for legal aid Ontario, you had to have an income of less than $22,000 for domestic violence related supports. Legal Aid Ontario during this time has waived all financial eligibility for survivors. So these changes are critical, and we really hope that we can show that there's a value in restrictions being lifted, right? That they provide women with greater options, that women will not take advantage or commit fraud of these policies or whatever those ridiculous assumptions people make about, loosening up some policies and programs. But what we want to show is that when the system is easier to navigate, we will see more women coming forward, we'll see more survivors reporting, and of course, more women will be able to establish safety. So I wanted to end on those two because really I think those two examples are something we can learn from while we approach advocating for the National Action Plan on Gender-Based Violence. So cooperation between governments and between governments and women's and feminist organizations. But also what we want to see is targeted programs, policies, and funds, of course, for those intersecting policy areas, right? Whether that's, and that might, other intersecting policy areas that might fall outside of other ministries. And also, of course, targeted policies, programs, and funds that are responsive to the specific issues and needs faced by specific groups of women. So highlighted there by some of the pieces of what's working well. Okay, thank you. I'll leave it there.
Perfect. Thank you so much, Lieran. That was such a rich presentation, and I think I really appreciated, across those 4 pillars of the National Action Plan: prevention, services, legal and justice responses, and social policy. You touched on quite a few of them throughout your presentation. And then also, some of the unique aspects of this time of delivering and doing work in gender-based violence, and talking about technology and talking about that increased cooperation. So I think these are really important themes for us to keep in mind. So I'm gonna introduce now our next speaker. So just give me 1 second as I pull up the deck here. So our next speaker is Erin Whitmore. Erin is the Executive Director of the Ending Violence Association of Canada, a national organization that aims to address and respond to all forms of gender-based violence, including sexual violence. Erin has been engaged in gender-based violence advocacy and research for over a decade in a range of different settings. And prior to her work, at Ending Violence Association of Canada, Erin worked as a senior researcher for the National Inquiry into Missing and Murdered Indigenous Women and Girls, as well as in research policy and direct service roles with provincial governments and community organizations. And I wanted to share, Erin and I have been part of the reissued call on a National Action Plan working group and have been coordinating on various different policy tables. And so I'm really glad to have Erin here to share the findings of a study that they recently did at Ending Violence Association of Canada. So I'm going to pass it over to you, Erin. And if you'd like to share the work that Erin is doing on Twitter, please use the Twitter account handle at EndViolenceCA. So without further ado, over to you, Erin.
Great, thanks so much, Anjum. And I am going to also assume that my slides are showing properly. So I'm really happy to be here today to be speaking to all of you out there listening about some of the work that the Ending Violence Association of Canada has been doing since the onset of the pandemic. And just to be participating in this important conversation about what we're learning in terms of the way that the pandemic is impacting gender-based violence survivors and service providers is really vital information that needs to be taken into account as work continues in shaping and building the National Action Plan. In my presentation today, I'm going to be providing a very brief overview of a national survey that we conducted to explore the impact of COVID-19 on gender-based violence survivors and service providers. We conducted this survey in collaboration with the London-based organization ANOVA and its Manager of Education, Training and Research, Dr. Annalise Trudel. And so the complete report is available on our website, and I think Anjum is posting that, and I have it at the end of the slide deck here as well. For the purposes of our presentation today, I'm just going to talk briefly about what we did in this survey and touch on some of the key findings that I think might be relevant to this bigger discussion that we're having related to the National Action Plan. So as both Anjum and Lieran have already kind of done in terms of setting the stage, when the pandemic started in early March, all of us working in the gender-based violence sector were immediately concerned about what it would mean in terms of its impacts on those who are experiencing violence, as well as on the services that support them. We knew that many of the measures that were being put in place to manage the health risks of the pandemic were ones that were likely to increase the risk of violence. But we also knew that many of these organizations, many sexual assault centers, shelters and transition houses, outreach programs, grassroots community organizations that provide gender-based violence services were, before the pandemic started, already working with limited and inadequate resources. Many had long waiting lists and a number of other challenges. So the pandemic, not only potentially increasing the risk for violence, also created another challenge for an already overburdened sector. So in this survey, we really wanted to capture this reality as it was unfolding and connect with and really learn from staff and volunteers who were providing gender-based violence support across the country, and to hear from them in their own words about their experiences and what it was like to be doing their own work. And I say in their own words, and I encourage people, if you have a chance, to look at our full report, because we used a qualitative method of data collection so that we had the opportunity to hear many of the stories that people people told us many stories about what they were experiencing. And I think that reading some of these experiences that people shared really helps create a picture of what this work has been like over the past few months. So briefly, we launched the survey in May, so about 3 months into the pandemic. And left it open for 2 months. In general, the survey asked questions that prompted individuals to talk about the impact of the pandemic on their services, the impact that they were seeing on survivors, the impact on their own mental health and well-being as service providers during this time, and then what some of their concerns were moving forward. Ultimately, when we closed the survey in July, we'd heard from 376 staff and volunteers. We had responses from those working in all of the provinces and territories, with the exception of Nunavut. We had a fairly even divide in terms of respondents who were working in urban centers and those who were working in more rural and remote settings. On the screen, you can also see a rough breakdown of the types of organizations that people who completed the survey were working in. So the majority of respondents were working in domestic violence shelters or transition houses. About a quarter of our respondents were working in sexual assault centers and services. But what we found really interesting was 33% of our respondents identified as working in other types of organizations. So this ranged from anything from settlement services to Indigenous focused organizations, to post-secondary campuses, to hospital-based services, and many more. And I point that out now because I think it's a really good reminder of how gender-based violence services are being provided in many different settings, and that survivors are accessing these services in a variety of settings that go beyond what we sometimes think about as just sexual assault centers and shelters and transition houses, and that's really something we want to be thinking about in terms of the National Action Plan. So I'll move now to to review some of our key findings, and just to say as well that our analysis at this point is still focused on kind of the national trends. We are hoping to do a more detailed analysis to look at some of the findings by region and by type of service, but at this point these findings speak to what we heard nationally. Similar to what Lieran has found in her research, the experiences that staff and volunteers shared in terms of what they were hearing from survivors was that this was, a time of increased prevalence and severity of violence. They also noted changes in the tactics used to commit violence. And this is, again, something that we've been hearing a lot of, where those who are choosing to use violence are taking advantage of the conditions the pandemic is creating to do so. So whether that's using the fact that people need to be isolated at home as a tool for engaging in violence, misusing information about the pandemic to exercise control, for instance, saying you're not allowed to go to a hospital or things like that. And of course, monitoring and controlling access to technology as another way of increasing that isolation and control. And so just as an example of what some of the staff and volunteers were saying, we hear from one shelter worker here who comments, "I've noticed that isolation during the pandemic has been a tipping point for some people, causing the abuse people experience to go from bad to worse, causing women and children to seek immediate shelter from partners." And so, not surprising, in addition to reporting changes in what they were noticing about the experiences of violence, staff and volunteers also reported changes and challenges in survivors' experiences of using services and seeking supports. So this included reluctance and fear to seek support because of concerns around contracting COVID-19. One of the findings, I think, that speaks to kind of one of the distinct impacts of the pandemic for survivors of gender-based violence is the way that some of the protocols that were required could be really triggering or reminiscent of controlling and abusive situations, and how this often made seeking support complicated. For some, the seeking gender-based violence services or continuing with the services that maybe they were already accessing was superseded by the need to meet basic needs for housing, food, technology, that we know that many survivors are, for many survivors are ongoing challenges, and that ones that became even more difficult during the pandemic. In terms of what we heard about the experiences that staff and volunteers were having doing this work, probably not surprising to anyone who is here today, this was certainly a time and continues to be a time of increased stress, exhaustion, and a real concern about the future and what that might hold for this work. The vast majority, 81% of respondents to the survey described experiencing an increase in work-related stress since the onset of the pandemic. And that in itself isn't necessarily a surprising finding. I think that that's common to people, whether you were working in the GBV sector or not. But one of the things that is interesting is when we look at the factors that people identified as contributing to that increased stress. And what stood out for us here is when we look at these factors, I think we see how they really speak to the commitment that those working in the gender-based violence sector have made to ensuring that those who need support get support. And so the contributors to this stress were really around the concerns that staff and volunteers were holding and carrying about those who were using their services. So these included, of course, concerns about how the pandemic was impacting survivors who were experiencing violence or working to heal from that violence. People spoke about the real sense of responsibility that they felt to protect other people from illness and from COVID if they were using their services. And then also this real sense of concern and uncertainty about the future and uncertainty about their organization's ability to continue to provide these services. And so all of these concerns were kind of, and I mean, I think continuing to create this constantly shifting situation where, as one respondent put it, you know, which fire do I put out? Each one is manageable on their own, but combined everything all at once was incredibly overwhelming. Keeping up to date on all of the changes of COVID while ensuring connection is maintained with clients, caring for others when I was struggling to care for myself. So I'll touch briefly now on what we heard in terms of kind of where we need to go now. And this was the final section of the report that we created, where we asked gender-based violence staff and volunteers to tell us a little bit more about what actions they think need to happen to ensure that survivors have access to the services they need and that their organizations have the resources that they need. And I'll start by reading the quotation on the screen, which I think really echoes what I've heard many of the respondents to our survey say, but also one that we've heard you know, I think broadly as we've been talking about where do we go from here. So this person said, I certainly think there will be issues in returning to normal, and this shift will occur slowly. However, I think framing it as a return to normal is incredibly problematic because our normal before the pandemic was not serving women who experience violence well. I think we ought to look at this pandemic as a learning lesson in the bigger picture of gender-based violence. And so when we looked at the responses that we received from people in answer to the survey questions about, you know, what they thought was necessary in the upcoming months and what they would like to see from government and decision makers, their answers really centered around 4 kind of key areas. So number 1, again, probably not too surprising to people who are listening today, was this concern and need for stable core funding that really reflects the complexity and the scope of services and the demand for services. We definitely heard from some survey respondents about the importance of the funding that was provided by the federal government to GBV services and how that was really essential to them in being able to continue to provide their services, but that there was this ongoing concern that this was a short-term solution and that there needs to be a sense of security in having that stable core funding. We also heard that what's really important in terms of ensuring that these long-term solutions that we're looking at are ones that don't simply repeat the status quo or maintain the status quo, is that addressing gender-based violence service provision must work harder to reflect intersectional and systemic approaches that really get at the root causes of gender-based violence and that center the experiences of Black, Indigenous, and racialized women, women with disabilities, non-status immigrant and refugee women, and trans, non-binary, and gender diverse folks. And so we heard from service providers that for many survivors, you know, the challenges that they were confronting during COVID were not only related to violence, but also were involved in the challenges that they were facing in meeting their basic needs or navigating systems that didn't necessarily have an understanding of their needs as survivors of gender-based violence. And so I think this is probably a point that we're going to take up in the discussion around the National Action Plan and about the importance of the National Action Plan really being cross-sectoral and adopting a whole of government approach. So just briefly, as I think I'm running out of time, I'll just note that the 2 other areas that respondents noted as important areas for action are ensuring that continued efforts are made to prevent gender-based violence in the first place, and then finally that there is a real effort to center the knowledge and expertise and experiences of gender-based violence staff and volunteers in this ongoing post-pandemic, well, ongoing pandemic, I guess, planning that we are working on. So just as kind of what we have in the works, I did want to just let people know that we are hosting on December 8th a virtual event that's bringing together a whole bunch of people who are doing research on gender-based violence and COVID-19. We know that there's tons of research happening at the community level, in academic spaces. And so this is really kind of an informal opportunity to learn about some of these different research projects that are happening and to look at the way they are connected. And so that event is open for anyone who may like to observe, and the registration information is on our social media. So I think I'll leave it there, and we can move into the discussion.
Great. Thank you so much, Erin. That was incredibly rich as well. And I saw so many overlapping themes with what Lieran shared earlier around the experiences of workers, of survivors, on the services themselves. So I'll invite Lieran to put on her camera as we go into the facilitated discussion. And I encourage people to also start to ask questions, put information in the chat, because we really want to have this dialogue on what this national action plan needs to look like in the context of COVID. In many ways, the issues that were present before have heightened, but we've also seen new challenges appear, particularly around the capacity to serve people during lockdowns, and how in many parts of the country, and in fact, many organizations, that capacity for that remote service provision, that needs to be invested in. And so I think one of the things I wanted to maybe first start off with, and Lieran, I'm going to direct this question to you. You spoke a lot about coordination, a lot about collaboration, and we've seen that. We've seen that in spades, and especially at the height of the pandemic, different governments working together. I'm wondering, you know, I will say one of the challenges we've seen and observed is how many workers who work and support survivors of gender-based violence. Earlier in the pandemic, when we were talking about essential workers, people were not thinking about people who were providing supports in shelters, providing counseling services. It was almost an afterthought. And even, for example, in acquisition of personal protective equipment, it was hard for shelters to get access to that. So I'm wondering, what are some of the lessons you've learned around how crucial it is to have gender-based violence service providers at the table, whether it's in public health response or in economic recovery? And you can kind of take the question as you will, but just what are the challenges and opportunities on the coordination and cooperation piece?
Yeah, I think that's a great piece. No, I think we have seen the value, right? And you know, we all know this, right? Research evidence shows this is the key influencing factor for the effectiveness of either a national action plan or any policy change for gender equity is the role of feminist movements and organizations, right? So like they have to be at the table. The other piece I would say though, Anjum, is how do we get women who have been disproportionately impacted by the pandemic, who are disproportionately impacted communities by gender equity, how do we get them at the table? That's what I worry about, because you know, I worry about the impact that the pandemic is going to have on the involvement of marginalized communities in public and political life, right? And we see that in other countries, kind of post-pandemics or post-crises, post-civil wars, where there's a kind of a bit of a fallout. And we know why, right? Women you know, they're dealing with work and finances and childcare. And I can't see that certain political movements or actions or getting them at the table for that cooperation is going to be a priority. So I think one thing we need to think about is how can we, you know, make sure that those central to this work are at the table as well. In terms of cooperation and coordination, I think things continue to work pretty well between our sector and the governments in terms of coordination, cooperation. I think where there's a greater need is actually between the levels of government, right? Between municipal governments, between municipal and provincial governments, where we often see the buck getting passed, right? Well, that's funded by the province. That's their thing. This is our issue, so we're going to deal with that. So I think there's an opportunity here to ensure, as advocates, as feminist and women's organizations, that the National Action Plan embeds more localized accountability to survivors at a provincial and municipal level, right? And that, so that there's accountability to that cooperation. You know, we've seen some through the National Housing Program that I think we could, you know, kind of mirror or learn from, where that national housing strategy has given supported municipalities to be more innovative in managing social housing or financial models. And so I think the National Action Plan for Gender-Based Violence could learn from that, right? And embed some more power at, you know, and accountability at a municipal and provincial. But I also think it's up to not only, you know, let's get at the table, but let's make sure the different levels of government are there, because that's when in my experience, that's when the really great, important conversations happen.
Yep, and that ability to share resources, learnings. I think no one expected at the start of this year dealing with the pandemic. So there's been so much interesting innovation happening and just really being there for communities that we don't want lost during this time. And Erin, you spoke about this in the work that you've done. You know, a question I have for you is, you know, in the different tables that you've been at and the different types of consultation, it seems like there's almost an allergic reaction to investing in organizations that provide these critical services. When you say core funding, when you say multi-year funding, it's like, why do we need that? And I feel, you know, and I think all of us here that are present would see the value of addressing gender-based violence as critical to economic recovery, but it almost feels like it's an afterthought. And I guess the question I have for you is, how do we tackle that? Especially, you know, right now it seems the public is just thinking about the pandemic, rightly so. We are in something unprecedented, but it seems all of the other issues that are also vital are being kind of pushed to the wayside. How do we tackle that? And how do we essentially center this conversation in recovery?
Thanks, Anjum, for that question. Yeah, I think that is a huge challenge, and I think that you know, one of the challenges and opportunities, which are often the same thing, with the National Action Plan, is that it is an opportunity for us to really develop a comprehensive and intersectional understanding of what gender-based violence looks like in Canada, and I think we're really missing that. And, you know, as I said earlier in my presentation, when we looked at the types of organizations that we heard from in our survey, you know, we heard from many different types of organizations. We know that gender-based violence work is happening in a whole bunch of different spaces. People are going to places where they feel safest, where they feel most comfortable, and that may not necessarily be a shelter. It may not be a community-based sexual assault center. It may be a settlement service or an Indigenous organization, an organization that focuses on providing services for people with disabilities. And I think that until we have that really in-depth picture of what these services look like, what gender-based violence itself looks like, and recognizing that it is a very complex, multifaceted problem, we are still going to be getting pushed to the margins in terms of you know, of people thinking about this as the public health crisis that it is, and as a really central problem that should be getting the same attention that some of the other issues that we're focusing on right now. So I think that, you know, the National Action Plan, if it is set up in a way to really create that type of a picture, is going to be really instrumental in bringing more attention to the issue of gender-based violence.
Yeah, and I really want to thank both of you for really helping us understand. I think the issue and concern we all have around gender-based violence sometimes feels insurmountable and feels challenging, and it's hard because, you know, this work is so difficult and different across the country. I'm wondering, you know, there's a couple questions coming through the chat, so maybe I'll first start with some of those. So there's a question here, and I think this is a really important one, and talks to how not only were situations before the crisis, before COVID, heightened now as it relates to gender-based violence, but they're also different. So specifically around access to technology. So the question is, what happens to lonely senior women who do not know how to use technology? How can we reach them? So we know elder abuse, that's something that's hidden as well, and is a form of gender-based violence. I'm wondering, who would like to start this off, and just what are you seeing, and what are the ways that we can address this?
Happy to touch on that. That's an excellent question, and completely agree. We need to look at those intersections between age and technology and access and where they are geographically, right? And I appreciate, I'm speaking from Toronto, right? And I recognize that when we do research, we're talking about access in Toronto, which looks very different than access even, 2 hours north of here. I would say again, for example, City of Toronto, they're promoting programs, but they're not very targeted, right? We're not seeing those specific access pieces. So we really do need to take a intersectional approach to ensure that not only programs, but those funds that are assigned to them are directly targeted at a population or a group, rather than the wide sweeping programs, but something that is actually targeted. I agree with the person who asked the question at, women who are older, who are isolated, living on their own, living lower income. We know that's a bracket for high levels of poverty in Canada, senior women, right? So let's have tech at a municipal, provincial, or a federal that's geared towards a particular population.
Great. I'll ask the next question, but Erin, if you want to answer this one too, feel free as well. A question asked in the chat is, can you speak to any associations you've seen in your work between substance abuse in the context of COVID-19 and GBV?
So the question was for any associations?
Or anything that you've observed in your work, for example.
Yeah, okay, sorry, thanks. I just needed that clarification there. So one of the things that did come through in our survey was that staff and volunteers were noticing that certainly survivors were experiencing increased challenges with mental health and well-being. So that included increased substance use and other forms of coping. And this was, this wasn't necessarily connected to experiences of violence. It could be that they were, the pandemic was creating a situation where their normal supports or the strategies they had put in place to manage some of the impacts of the violence they had experienced in the past were impacted, and so they were experiencing sort of this increase in impact around that. So that is one thing that I think came through our survey related to that.
Thank you. I think there's been so many interesting conversations. It seems like this national action plan really needs to ensure that we are at the table, organizations that support survivors of gender-based violence, because it is so complex. It is so challenging. It is across so many different jurisdictions and issues and communities. So maybe what I'd like to do is, I know we could talk about this for perhaps another hour, but if there's one thing you want people here listening to leave with, what would you like them to leave with? So maybe I'll start with Lieran. I'm going to ask you first.
Sure. Well, something, as I think is always important to leave with is that, the government continues to talk about kind of getting back to the normal, getting back to the norm, getting back to how things. And so I within the sector and across feminist organizations right now, we're talking about the opposite, right? We're talking about a new norm and how do we create that. And so I think you're right. Anjum, let's talk and find ways to get to the table, but also let's bring new ideas to that table, right? Let's bring radical ideas to that table. I saw a question around kind of women's ownership and housing ownership. That's what we should be taking to the table, right? We shouldn't just be taking short-term shelter, social housing, affordable housing. Yes, those are all important, but let's take some new ideas, which is they shouldn't be new at this time, but they are, right? Around like, how do we get women's ownership at the table? How do we get the conversation around women's right to remain in their own home with the perpetrator removed? So that's what I just, to add to your point, I think let's get at the table, but then also let's kind of really push for some new solutions and really talk about being a little bit more bold than what strategies have looked like in the past for us.
Yeah, and I so appreciate that, because I think for so long we have had to essentially be strategic and kind of play the incremental game. But what this pandemic has done is created this unprecedented policy window. So how do we take advantage? And I appreciate everything that you're saying, Lieran. So I really hope people take that to heart. Erin, final word to you, and then I'll do some closing kind of wrap up.
Sure, and I'll just echo what Lieran said and build on that a little bit, that I agree. And I think that we're seeing, as much as challenging as this has been for the gender-based violence sector, we're seeing these incredible stories of creativity, of innovation. We certainly heard in the survey that we conducted many successes in ways that our organizations are pulling on their intersectional feminist understandings, their trauma-informed understandings, to create solutions that are really going to make a systemic difference. And I think that really centering that knowledge is going to be really important as well.
Amazing. And I think that's absolutely necessary, really grounded in community experience and survivor experience, because that is how we will build back better and create that society that truly works for all of us. So with that, I really like to thank both of you. Thank you so much, Lieran. Thank you so much, Erin. I know what a busy, week this has been, month this has been, pandemic this has been. So we appreciate it here at YWCA Canada for taking time out of your day to share with us and engage with us. So I'd like to also thank everyone who is here listening and watching and participating. This is a conversation that is ongoing. And what we want to do in a future conversation is look at other countries in the world that have established a national action plan and see what lessons we can learn, for example, from Australia, as we build out Canada's plan as members of civil society. I also want to take this opportunity to thank my incredible colleagues at the National Office, Andrea and Rain, and the incredible team who has made this event happen. So a round of applause for them as well, who are making all of this happen for us to connect despite the distance. So with that, thank you everyone, and we look forward to staying in touch. I've also put in the chat, if you want to connect with YWCA Canada's VAW network, we encourage you. This is something you don't have to be part of a YWCA. If you're part of the VAW community at large across Canada, you can participate. So the link is in the chat. So with that, bye everyone, stay safe during these difficult times, and we hope to stay connected with all of you. Bye for now.